Hi, this is Denise Miller doing assessment number 2 for NURS320 with patient Robert M., 50-year-old male. Thank you. Robert, hi. Thank you for coming in today. How are you doing?
Fine.
Okay, great. I just need to check and see a few things for your health assessment today. First of all, I want to know, do you know your date of birth?
5/5/67.
And could you please tell me what year it is?
2017.
And could you also tell me what city you live in?
Phillipsburg.
Okay. And the other thing we want to talk about today is your memory. Do you know, if I were to ask you about a cat versus a kitten, what would you say a dog is to?
A puppy.
Awesome. And also, I wanted to know, have you been feeling nervous or anxious?
No.
On a zero being not at all, and 3, you think about it often. So feeling of anxiety.
0.
And being able to stop or control your worrying, 0 to 3. 0 is not at all, 3
1.
is all the time.
1.
Okay. And over the past 2 weeks, have you felt down or depressed? A 0 is not at all, and a 3 is all the time.
0.
And over the past 2 weeks, have you had any little or no interest in doing things that you used to have an interest in? 0 is not at all, 3 is all the time.
0.
Okay, next we're going to get ready to do your assessment of your neck and your heart and peripheral vascular system. So I'm going to have you go ahead and take your shirt off. If you could just wait one moment and I will give you some privacy. All right, thank you for this. I'm going to check your neck first. I'm just going to take a look here. Okay, can you turn your head to your left? Good. And come over to the right. Good. I'm also going to just pull this down. Good. 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 Okay. Next, I'm going to fill your carotid arteries. Good. Good. And then I'm going to listen to your carotid arteries. Good. Okay. So, Robert, next I'm going to just fill your chest, okay? And we're just checking your pulses here. And then I'm going to take a listen. If you could take a deep breath in and then exhale it and hold it. Now I'm going to be listening all over your chest, so please don't be alarmed that I'm actually hearing anything different. That's just the way that we listen to your chest to make sure that we're hearing things, because some areas of your chest where your heart is, we hear better in other areas, okay? So deep breath in, exhale, and then hold that. Thank you. And exhale. Good. Now breathe normal. Good. Thank you. Next, we're going to take a look at your stomach. I do want to check before we go into your abdomen, your pulses, okay? Good. Let me see. Both sides. Very good. Good. It's going to come down to your feet here. Good. Good. And we're just going to go right here. Okay, good. And then I'm going to take my light and just take a good look at your stomach. And I don't see any scars or any areas. Nice. I do not see any pulsations. And then I'm going to listen. Okay. Again, I'm going to listen all over your stomach here, so don't be alarmed whenever I listen to different areas. Good bowel sounds. Next, I'm going to palpate your stomach. And we're just tapping here to see if we how everything sounds. Let me see if I can feel your liver. Good. Any pain or tenderness? Okay, good. That looks good to me. Okay, now we're going to take a look at your legs. So I'm just going to pull this up so I can take a good look here. And your legs are the same in size. Nothing abnormal there. And skin's nice and warm and dry. And again, checking your pulses. Good. 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 And I don't see any swelling. Any reason to be concerned with swelling? Have you had any heart problems before? Good. And I'm just going to take your toes and take a peek here. Good. Very good. Next, I'd like you to take your left leg and lift it straight up. That's good. And down. And your right leg. Good. And then I want you to lift it both legs together. Good. Good. Now press on my hands. Good. And then lift my hands up. Good. Good strength in your legs too. The next thing I'd like you to do is take your left heel and slide it down take it to your knee and slide it down over your shin on your right leg. Good. And then do it on the opposite. All right. Good job. Next, I'm going to have you sit up. So I'll give you a minute to go ahead and sit up. Okay. We're going to check some reflexes now, okay? Just bend here. Good. Good. And then if you can put your hands together, get your thumb. Good. And good. All right. And next, let me check your knees here. Okay, great. Now, if you could just swing yourself over to the table, and if you could just put this leg over that one. Good. And switch. Good. Okay, you can uncross those. Just going to check your feet. Good. Good. Okay. And next I'm just going to get the back here. And very good. All right. Great. Thank you. If you want to swing over to the side so you're facing out again. Good. So this time I want you to close your eyes. I'm going to check some sensation and see if you know what you feel and check your coordination too. Okay, so first of all, close your eyes and I'm going to hand you something and I want you to feel it and tell me what it feels like.
A toy truck.
Okay, good. And the other hand, I'm going to give you something different. What's that feel like?
A toy truck.
Perfect. Okay. And Then I'm going to touch you. You can open your eyes. I'm going to touch your skin with a cotton ball, and I want you to point with your hand where I'm touching you. So close your eyes. And if you could actually point, actually touch the spot I touch. Okay, good job. And then I want you to tell me if you feel something sharp, like this,
Okay.
or something dull, like this.
Okay.
Okay?
Let me close my eyes again.
This is going to be dull, or this is going to be sharp, excuse me, and this is going to be dull.
Okay.
Okay? All right, so close your eyes.
Sharp. Sharp. Dull. 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 Sharp. Dull. Sharp. 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 Dull. 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 Sharp. Sharp.
All right, good job. All right. And next I want you to take your fingers and actually take your hands and move them like this, okay? And then back and forth, flipping up and down. Good. Now touch your nose with your left index finger and your right index finger. Good. All right. And next I'd like you to raise your eyebrows and wrinkle your forehead and smile. And show your, this time when you smile, don't show your teeth. Good. Good. And then I want you to puff out your lips like you're going to whistle. Okay. And then I would like you to show me your teeth. Good. Now you can relax. All right. Very good. And normally I would also test vibration, but I'm unable to in your home today. I do not have that tool with me. So the next thing we're going to do is just have you walk. And I just want you to walk heel to toe first. So go ahead and stand up. And start where I'm at here. And just walk heel to toe. Okay. Good. Now turn around. And come back heel to toe. Now I'd like you to turn around and walk on your toes. And then turn around and walk on your heels. Okay, good. Now turn and face me. Good. Feet together. Good. Now just close your eyes. Good. And this is just checking your balance to see how you feel. Go ahead and open. How do you feel? Did you feel like you were losing your balance? Okay, perfect. Now, if I could just have you bend your knees back. Good. And the other one. Good. And then bend and touch your toes. Good. Good. And go ahead and stand up. All right. And you can have a seat. We're just going to check your shoulders and your hands and your elbow movement also. So if you could just stand up. And turn this way. And I want you to put your hands behind your back and lift them. Lift them up like this. There you go. Good. And then I want you to go ahead and turn and face me. And hands to your side and lift them up and down. Good. And then take your left hand and put it behind your back and hold it with your right. Good. And then switch. Good. And then take your hands and put them behind your head like this. Okay, you can go ahead and sit down. And then I'd like you just to bend your wrist, or your elbows, excuse me, and down. Good. And then wrist up. Good. Fingers out, closed, and then fingers out again and together. So your fingers are all together. Good. Okay, you can relax your hands down. So thank you for coming in. The only thing I found, which I believe you told me in your health history, was that you had a heart murmur, and I did hear that today. Everything else looks excellent. So keep up the good work, and we'll see you next year for your next appointment. Thank you.
Thank you.